I like cardiology because I think it's a field that is constantly evolving and advancing, and particularly electrophysiology because when I was training, I realized that I had a passion for it. The potential is huge. It has already revolutionized the diagnosis and detection of cardiac arrhythmia. The most basic tool that we use is an electrocardiogram, so that alone will give us the diagnosis most of the time. But of course, sometimes cardiac arrhythmias, what we call paroxysmal, meaning that it comes and goes. So it may not be so easy to detect with just a single ECG. Therefore, we will also sometimes rely on prolonged recording devices, which can monitor the patient's heart rhythm for days to even a week or more, so that we can increase the chances of us catching the patient's arrhythmia. But sometimes when medication is not suitable or doesn't work, then we will consider other treatment options, such as, for example, pacemakers, or proceeding with electrophysiology study and ablation procedure. I think patients with pacemakers should go out and live their life as normal, although there are some minor restrictions, but generally speaking, patients with pacemakers should be able to live their life as normal as possible. I think it will change the diagnosis and detection of arrhythmia quite significantly, because patients can have greater access to devices that will allow them to record and monitor their own heart rhythms. They can even purchase these devices themselves. For example, smartwatches nowadays are very advanced and they are able to record simple ECGs. So I think this will lead to much earlier detection and treatment of cardiac arrhythmias. Sudden cardiac arrest usually means somebody collapsing all of a sudden. A heart attack, in many ways, also may appear or present in the same way. Because typically when we say a heart attack, we are usually thinking about a blockage of the coronary artery. So a sudden blockage of the artery then leading to a cardiac arrest. If we witness somebody collapsing suddenly, then of course the first thing is to check that the patient is okay. If the person is found not to have a pulse or is unresponsive, then of course those who are trained to be able to deliver CPR should try and start that on the spot. I think the current challenges that we face is raising awareness. Of course, patients and also the general public will need to be educated on what cardiac arrhythmia means, and once they understand that, there's also a challenge that they may face in the form of getting access to EP services. So I think it's something that we'll have to try and address and work together as a community to raise awareness and also to improve access to our services.